Good afternoon, everyone. My name is Deshaun Gross. We'll give folks a couple of minutes to sign in, but if you could go ahead and put your name, your organization, and whether you're a task force member in the chat, that would be great. And then a couple of other kind of housekeeping items. We encourage everyone to be on camera to increase engagement during this meeting. Please make sure you mute yourself when you're not speaking. If you have a comment or question, please make sure to raise your hand and we'll address that. And if you're not a member of the task force, please kindly hold your questions till the end of the meeting. There'll be a period of time where we'll be taking public comments or add your questions to the chat and we'll adjust them as they come up. And with that, I will turn it over to Melissa Bird.
Thank you, Deshaun, and good afternoon, everyone. I am Melissa Bird, Medicaid Director and serving as the Government Co-Chair of this task force. I call the meeting to order at 4:03 p.m. on Tuesday, January 31st. I'd like to start off by saying just a thank you and our appreciation to everyone that has expressed interest in serving on this task force, and most definitely a congratulations to our task force members. Thank you for your time and commitment on such an important issue. Today's focus is twofold. We are organizing the task force and setting a baseline of information on the district's perinatal mental health programs. Our goal for today's meeting is to get to know each other and our expectations for our work over the next several months, identify a task force co-chair, approve the cadence of our meetings, and develop an understanding of the current district perinatal mental health programs. I look forward to working with you over the next several months to develop recommendations on how the district can improve perinatal mental health for birthing people and families across the city. Through the work on last year's Maternal Health Advisory Group at the Department of Healthcare Finance, I believe we have a great foundation of work to build on, so this is a really exciting time for us all. Sean, can you go to the next slide, please? So our approach to the Perinatal Mental Health Task Force follows our approach to the Maternal Health Advisory Group that we hosted last year. And what that looks like is it's a core task force supported by subcommittees, all structured to be inclusive and to represent as many perspectives as possible, including beneficiaries and residents, doulas, in that case, the Maternal Health Advisory Group, providers, and payers. This structure really allowed a dynamic discussion that shaped what became the doula services benefit for Medicaid Alliance beneficiaries. For example, what you see before you, our decision to reimburse differently for perinatal and postpartum doula visits really came from the input from the Maternal Health Advisory Group and informing us of really how those services are different. And also the input from the group helped determine the total number of doula visits that we would reimburse for. We anticipate that the subcommittee work will begin in March and will be open to public participation. So whereas the task force is a set group of members, we really do appreciate the opportunity through subcommittee work to open up to all public participation that's inclusive of task force members, but really making sure we get an inclusive group that represents all perspectives. As you think through and we talk more about what we hope to accomplish over the next few months, if you have any ideas on how to structure the subcommittees, please reach out to Deshaun Groves. And if you don't already have his email before we end today, it will go into the chat and you've probably already received emails from him. So why are we here today? Our purpose is to provide a set of comprehensive policy recommendations for the improvement of perinatal mental health with a focus on vulnerable populations and risk factors for perinatal mental health disorders, evidence-based practices for those at risk, barriers to access and evidence-based practices to improve how people navigate the healthcare system and to improve services. Next slide, please. Promoting access to care, supporting a viable and stable workforce, and then also looking at sustainability, looking at both public and private funding, and identifying what related programs, treatments, and services are available. And if you don't already have the slides, we will disseminate them, and then you'll have all this detail before you. I didn't go into every word that's on the slides before you. We have a three-phase approach to our work. Phase one is complete. It was the pre-selection and selection of membership. And now today marks the start of phase two. And this phase continues through July 2023, where we will have our regular work meetings and the subcommittee meetings as well. Once we complete the kind of the meat of the work, if you will, over the next 7 months, we'll move into phase three, which is really where we will begin pulling together the work of the subcommittees to identify recommendations for the final report. So with that, the overview is complete, and now we're going to move into our roundtable discussion. During this time, each member has the opportunity to introduce themselves, including as you introduce yourself, talk about why you want to serve on this task force and what expectations you have for the task force and our work. As you listen to each other, I do encourage you to try to identify any themes and how they may shape the direction of our work. So I am happy to kick this off unless there is anyone that would like to go first. Figured I'd be kicking us off. So again, I'm Melissa. I'm the Medicaid director. You know, this is personal and professional for me. Personally, I'm a mom of two. I have depression and anxiety, and I've had you know, just those experiences of trying to manage those conditions throughout my life, really. But certainly, just took on a whole different perspective, if you will, once I had children, and trying to you know, do the best I could for myself so I could be the best mom I could be. You know, professionally, you know, it can be such a difficult time to become a parent, and it can be a great time and it can be really not a great time. And I want to make sure, or my hope through our work is making sure that we have the resources and services available to any district resident so that they can move through that major life transition of becoming a parent or becoming a parent of multiple children with a way that is meets their hopes and goals and ultimately creates a successful and just really enjoyable family experience for folks. So I will look to see if anybody else would speak up. Otherwise, I will start calling names. And feel free to just unmute yourself if you'd like to go.
I can go.
Okay, thank you.
My name is Katie Whitehouse, and I work for Councilmember Robert White at the DC Council. I am a task force member by virtue of Councilmember White's chairmanship on the Committee on Housing, which now has jurisdiction over the Department of Human Services. And so that's why I'm here. As far as expectations go, I'm not sure I'm coming into this work with many expectations for the task force, although I will say, prior to working for the council, I worked for National League of Cities and focused on early childhood education. And there was just always a need to go back further and further to birth and then prior and to the prenatal space. And so I'm excited to be able to work on that and make sure that, as you said, Melissa, that everybody in DC has the services they need to get through this transition. Thank you.
Thanks, Katie, and welcome to the task force.
I'll go next. I'm Lauren Demosthenes. I'm an OBGYN. I am the senior medical director with Baby Scripts, which is a digital maternal healthcare company. I'm a mother of three. Now I have a daughter who's pregnant, who's gone through 3 years of infertility. So kind of have some insight now into that side of stress. When I was practicing clinically, I saw that there was difficulty in just getting the screening done. We have to screen for just so many different things during pregnancy, and then who to refer somebody who had a positive screen to was an issue because there weren't very many people available to refer people to. And then I also work in the area of substance use disorder. I teach that at a medical school, and I see that as an increasing problem, and that overlaps greatly with mental health. So I'm hoping that we can be creative and use some digital tools in helping women now in 2023 to access help, and also to improve even the screening for anxiety and depression, both first prenatal visit, throughout pregnancy, and again in the postpartum. So that's me.
Thank you, Lauren. Good to meet you.
Good afternoon. I'm Jasmine Bim. I'll go next. I am the Perinatal and Infant Health Division Chief at DC Health, and I'm a member by virtue of being a representative of DC Health, but also very much interested in the topic area personally and professionally. I look forward to this meeting of the minds to discuss, feasible, actionable, and systems level recommendations. This area of mental health just has so much stigma, let alone perinatal mental health, a period when a lot of people believe you should be talking about joyful things and happiness, and so don't want to necessarily share issues that they may be having. And so I'm looking forward to working with you all to come up with some great recommendations. Thank you.
Thank you, Dr. Bahim, and welcome.
I'll go next. My name's Amy Danielson. I'm a clinical psychologist, and I work at MedStar Georgetown in the Department of Psychiatry. And I also work with a program for mothers at Washington Hospital Center. I'm thrilled to be here and thrilled this group is gathering. I think my hopes, I don't know that I have expectations, but my hopes are that, in seeing other states, other areas of the country form perinatal task force, maternal mental health task force over the years, and seeing important programs and policies follow out of that work that really increase screening and access to care and additional supports and services. My hopes are that this is the beginning of some of that important work for DC. So I'm really excited to be here, and it's personal for me too. I have 3 daughters of my own. I work in a higher acuity setting, so I work with a lot of perinatal individuals who have severe psychiatric illness. And in light of the tragedies last week in Massachusetts for a mother and family there, what I'm hoping that this task force will serve is to expand the options and resources for psychiatric care in our city for women with severe psychiatric illness, because we really just do not have enough options there in hopes of preventing an outcome, a tragedy like that in DC. So I'm really happy to be here. Thanks.
Welcome to the task force.
I'll go next if that's okay. I'm Raymond Tu. I'm Senior Medical Director, Chief Medical Officer, MedStar Family Choice, District of Columbia. I'm a native Washingtonian, born and raised in DC. Was born at Washington Hospital Center in 1962, so I'm a long-term beneficiary of MedStar. But I'm also a very passionate person regarding healthcare for all of our residents. I started at United Medical Center in 1977 and went and worked there throughout the entire drama of where care was not great. And when I was chief medical officer, we were out of the Washington Post, and I was so emboldened by the needs for our residents to get excellent perinatal care, as well as care after the delivery, I'm sorry, I'm getting a little emotional. But the reason why I'm so passionate about being a part of this group is that not only are we a health plan with MedStar Family Choice DC, but just like what was described previously, we are a provider of healthcare. And so hearing how everybody can work together will be so critical in order to get great outcomes. So I'm so happy that we have another partner of MedStar on this committee, and Amy and I are going to become good friends, I'm sure. But Melissa knows I've been very passionate about Medicaid. On our first day, I knocked on her door and introduced myself. So I'm so pleased to be a part of this group. Thank you.
Thank you, Dr. Tu. It's good to see you.
If it's okay, I can go next. Well, good afternoon, everyone. I'm Natoya Mitchell, and I am an advocate as well as a healthcare partner for children, women, and families throughout the DC metropolitan area. I really look forward to the continuing discussion as we look at our partners, how are we able to look at different policies, but most importantly, making sure that we are considering policy and recommendations that will benefit the patients overall. So again, I look forward to working with everyone here that's on the team.
Toya, welcome.
If it's okay, I can go next. My name is Michael McGee. I am representing Healthy DC and Me. I'm also a student at Bowie State University. My research is on the fetal psychological development as it correlates with the mother's stressful environment. I was raised in a household with all women. I have 4 girls of my own. Very personal to me to make sure that my girls, as well as everyone else inside of DC, get the services they need. And I'm also looking to go into my doctoral program on the neuropsychology, looking at how the hormones affect the baby's psychological development.
Thank you, Mr. McKee. Sup?
I can go next. I'm sorry. Good evening, everyone. My name is Amina Hamilton. I am the EPSDT Program Manager for AmeriHealth Caritas. In addition, I am Vice President of the DC Breastfeeding Coalition. And it's beautiful to hear everyone's participation on this task force coming from a professional standpoint, but also personal. I am a mother of a 6-year-old who I had my child at 40. And so that drastic change definitely had an impact on me. And so my hope, not necessarily an expectation, is to really see how we develop this program and what we're doing as far as perinatal, but how we transition it into postpartum as well. So just thank you, everyone, for your time tonight.
And then welcome to the task force.
Hi, I'm
Hello.
Andrea Gallico. Oh, I think 2 of us are going.
Okay, go ahead.
Okay. I think I'm supposed to go after Amina because I also became a mom at the age of 40, 3.5 years ago. So that's my personal connection here. My name is Andrea Agalico. I'm a social worker at Mary's Center, and I oversee our perinatal mental health program. So I do provide clinical services as well as work in program like oversight and supervision of other clinicians. So I'm glad to be in this room with you all, and it's been great hearing about everyone's background. Some of the things I'm hoping that we'll be able to focus on is figuring out where there are gaps in care, especially for populations that may be underserved, thinking about recent immigrants in terms of language barriers to care, thinking about the LGBTQ plus community and making sure we have culturally relevant care for them. So those are some gaps that I'm interested in exploring. I'm hoping that we can come up with some policy recommendations around workforce development for behavioral health, be thinking about recommendations that are around prevention and the use of things like mothers and babies or home visiting, and continuing to build upon those models to support our perinatal population with services that don't necessarily need behavioral health to be provided. Thank you.
Welcome to the task force. Next.
Hi, this is Annette Lee. I can go next. I have been dealing with the mental health population for over 20 years. My specialty has been geriatrics and children. I'm very interested in this population. I am a mother, and I became a mother at 35 and divorced a year later. So I know about all the anxiety and stress comes with raising a child. I'm very interested in this topic because I want to learn more about this population and hopefully come up with recommendations that can help meet their needs.
Thank you, Annette. Welcome to the task force. I'm going to introduce yourself. Yep, go ahead.
Okay. Good afternoon, everyone. My name is Wanda Wilson. I'm a clinical social worker with DC Department of Behavioral Health. I'm assigned to the PEACE program. It's the Parent Infant Early Childhood Enhancement Program. and we provide services for young children, as well as we have a small group of women who are living with pre and postnatal depression. I have been working with families, more specifically young children or young youth of childbearing age, for over maybe 15 years. And I'm always interested in just in terms of access and still the issue of stigma and mental health. So prenatal mental health has always been a passion of mine, and so I'm excited to be a part of this force to learn more about how we can actually reach those, more specifically that population of women.
Wanda, welcome to the task force.
I can go next. My name's Anna Kuzman. I'm a licensed clinical social worker at Children's National Hospital, and I have been part of the founding group working on universal screening for postpartum mental health in our emergency room and in our neonatal intensive care unit in the NICU since September 2020. I'm part of the group of programs that's funded by the Clark Parent-Child Health Initiative to further strengthen the network of programs provided for caregivers and infants in the district. I feel very strongly that this is a public health issue, and I'm happy to have a hand in providing support and services and coordinating care to our families that come through both of those units. Our team is working on both remote screening of these of mental health needs and in person, of course. And the emergency room and NICU are both two places in our hospital that intercept caregivers that are in a high acuity place of their mental health needs. So I'm really excited to work with everybody to brainstorm solutions of how we can work less in our silos, but better connect caregivers to ongoing support once they're discharged from the hospital and with our providers in the community. Thank you.
Welcome. Else like to introduce themselves at this time?
I can go.
Hey, Brian.
Brian Harrison. I'm Deputy Mayor Wayne Hernage's designee for this from his office. So I'm kind of here to and hope to, use my view of the HHS cluster as a whole in DC government and kind of from the policy and budget and all of that side and see ways that, we can use his office here to help kind of, increase awareness, build out utilization and services and kind of just across the board for anything that we come up with recommendations for.
Thank you, Brian, and welcome.
Hi, I'm Nandi Barton. I am a mom of two. I also have depression and anxiety and also PTSD that I constantly suffer with. I'm here to be a voice to all like Black mamas that constantly don't get to be heard or are misunderstood, because when they are strengthened or when they do feel like they are able to share, it's at a point where they are frustrated, overwhelmed, and tired, and then they get written off as aggressive and barred off to be this barred person that no longer needs to be around anyone or their voice is not important. But I just really hope to be a voice for mothers that experience anxiety and is just so frustrated with being overjoyed about bringing life and having to protect life. But we still have to fight to get appropriate housing or to get appropriate jobs where they understand that I am a mother and I need to be able to make an income. But people don't know that when you're a mother, you have to call out. Especially, we know the single mother population is like 1 in 4 in DC. Or when we reach out for help, they look at us like, well, you're not giving your child enough attention, so maybe your child is having behavioral problems because of you. So many factors that go in that people don't see because or hear about, because when we are finally at a point where we're going to speak, it's like we are up against the wall and we're yelling and we are frustrated with the system. So I appreciate this task for allowing someone that is not a professional to be in this space and to actually hear the voices of Black mothers in this city. And I really want to be here to hold this team accountable, as well as the city council, to actually make change that's actually going to create a nurturing environment for moms to thrive, and so their children can thrive, and so we can have a city where we can have a wholesome environment. A lot of people call me flower because I use floral metaphors a lot, and we know flowers, everyone says that all flowers need sunshine, sun, water, and good fertilizer, but some flowers need to be indoors for 3 months to grow. Like, we really need to tackle down and individualize our families and understand that we are humans, and that's the most important part. And so that's what I expect of this team, to know that we are humans. Even though we have anxiety and depression, like, we are still humans.
You, Nandi, it's great to see you again, and welcome to the task force.
I can go. My name's Leslie. My pronouns are she, her. I work at Community of Hope. I'm the director of integrated emotional wellness there. So I have quite a bit of clinical time, and then I also oversee all of our integration programs, which includes emotional wellness integration into our midwifery.
Hey, Leslie, it's a little difficult to hear you, I think, at least it is on my end. If you can get closer to a mic, possibly.
Shall I start yelling?
Okay. Sorry.
Okay, so I don't know what you heard, but I'm Leslie. My pronouns are she, her. I'm the director of integrated emotional wellness at Community of Hope. I have a whole bunch of clinical time, and then also oversee our emotional wellness integration into our maternal and child health and midwifery programs. I'm really excited to talk about with this group ways that we can center particularly non-white and non-clinical interventions to strengthen perinatal health overall, but in particular perinatal mental health. So looking forward to working more closely with everyone.
Great. Thank you, Leslie. Welcome to the task force. We have about 3 or 4, maybe 5 more folks. I can call on folks, or feel free to unmic yourself or unmute yourself.
I can go if that's okay with everyone. Good afternoon, everyone. My name is Jenny Mancino. I am a home visiting program manager at Mary Center. My background is in clinical social work, and I've worked with the perinatal population in a variety of settings. And so I'm just really looking forward to being a part of such a wonderful group of individuals, and everyone's so passionate. And so I can't wait to learn from all of you. And I'm really looking forward to hopefully this task force just really ensuring that access to care is that families in DC are able to navigate care and mental health support more easily, and that the support that they receive is inclusive. And so I'm just looking forward to all the policy recommendations and just learning from each of you. Thank you.
Thank you, Jenny, and welcome to the task force.
Can you all hear me? Oh, great. I kept unmuting and then realized my mic wasn't working. I'm Mona Balkas. I'm the committee director for the Committee on Health, which Councilmember Christina Henderson chairs. The councilmember was a really big champion of this task force and continues to be, and we're really excited to be represented. And I'm new. I started, this is my 4th week. So definitely still on a steep learning curve, and really looking forward to learning from you all. And of course, the council member is eager to get the policy recommendations that come out of this task force as well. So thanks for including me, and looking forward to working with all of you.
Thank you, Ona. Welcome.
Hi, everyone. My name is Sydney Wilson. I am a doula and a social worker and a mommy. I've been momming all day. I was one of the moms that had to take off work. I was stressing this morning because I was sad. Give me 1 second, okay? I also am the director of programs at Mama Toto Village, and that is who I represent here as a member of the task force. Also love to see so many social workers in a space. I am a social worker as well, so shout out to us. I really hope that with just working with you all, that the work that we do has some recommendations in regards to the workforce part of perinatal mental health. That is something I'm really passionate about. Also realizing that I'm having a hard time finding mental health therapists out there right now. That's actually one of my current struggles. So I really am interested in having those conversations. But also hoping that at the end of this, there are really some viable recommendations in regards to screenings. So for both parents, for all parents, not just moms. So really happy to be here and a part of this amazing group. Thanks for having me.
Thank you, Sydney, and welcome to the task force. We have, is Lenore with us?
Lenore was unable to make it, unfortunately. She's currently working in the emergency room here and was unable to step away.
Okay, thanks so much for that, Anna. And then Fari? Sean, I think we covered everyone.
Yes, everyone
Give a
has.
nod for that. Okay, good. I'm tracking right. I just want to make sure. Well, thank you, everyone. I think what we learned from the Maternal Health Advisory Group last year is setting aside this time to really understand and get to know each other is really valuable. And was probably, for me personally, last year was the best meeting, like public meeting I had as a public servant. So I appreciate everyone giving your time and being open and willing to share with this group. A couple of the themes for me that just popped out that I heard repeatedly, I'll just use words right now: screening, access, and workforce. And clearly those are all interrelated too. You can see, screening as a way to get access to what you need, or just to acknowledge that a service is needed. Workforce is obviously an access issue just as well. If you don't have the workers, then you can't get access to the service and so forth. So from listening to everyone, those are, I think, the three key areas that really popped out to me from what I heard kind of repeatedly from folks. So a little bit of direction already from the group, so thank you so much for that. Next up, we have, I think Deshawn's going to bring the slides back on. We need a co-chair. The legislation directs the task force to have co-chairs, one government and one non-government chair. I'm here as your government chair, and would like to certainly have a non-government chair that we can work together closely, really with the focus on setting meeting agendas and trying to kind of give that guidance to the pathway for our work going forward. If you're interested in serving as co-chair, please speak up now. If we have more than one person who's interested, I will ask each of you just to give a statement, and then we will call for a vote. So I will pause for a moment, let folks think. Yes, Nandi, is that interest in being co-chair?
Oh, yes.
Okay, thank you, Nandi. I was like, if you're head nodding, I can't see you. Anybody else with the interest in co-chairing today, or well, for the duration?
I'm not that excited about running against Nandi. I love Nandi.
I know, right?
But I coming into the meeting, I was going to throw my hat in the ring as well.
Okay, so is that an affirmative yes, or okay? So Amy and Nandi, one more moment. Sean, do you see any other hands up? Feel free to speak up if you're interested. Okay. Let's see well, let me give you guys just a moment then to think about what we'll do in just a second. I'll just ask each of you, Nandi, I'll ask you to go first since your hand was up first. If you'd just like to make a brief statement of why you would like to serve as co-chair. So if you need a moment to think through things, please take a moment. Otherwise, you can speak up when you're ready. Okay.
Melissa, could I ask a quick question? Could you just discuss the role of the co-chair so that might help us better understand
Sure. Well, I'm learning this as we go along as well. But what I anticipate as co-chair, it really is our focus will be making sure that we stay on task and we're meeting the requirements of the deliverables through the legislation. So making sure we get to that endpoint of having the comprehensive report of recommendations. I think more of the day-to-day is going to be probably a monthly touch base to talk about agenda for the task force meetings. Talk about overall kind of, what direction do we need to go into and putting forward, making sure we have the resources available to support that. And then also I would anticipate probably some participation on the subcommittees depending on how those work out. Deshaun, as my special projects officer, is essentially staffing the task force. So between he and my executive assistant will have support in terms of actually like creating the agenda, some of that logistical work. But I really anticipate it would probably be, a monthly meeting to do that touch base and decide on agenda items and talk through how the group is progressing. So I hope that helps a little bit. Again, this being meeting one, things can always change, but that's what I anticipate, just kind of normal course of business.
Thank you.
Want to give it a go, Nandi? Or if you need another moment, take a moment. I realize now we probably should have built in a little break to give you guys time, or we can always go to the Department of Health and DBH to do their presentation and come back to you guys and do a call, do the vote then. Would that be more helpful?
Yes.
Okay, let's do that then. So we're going to switch things up just a little bit. So what we will do is we did want to start some baseline sharing of information so that we are all coming, we've shared our personal and professional reasons for being here, but also wanted to give a sense of kind of what's available through the district government at this time for perinatal mental health programs. We are fortunate to have two of our members representing DC Health and Department of Behavioral Health join us today to speak to what we already have in existence in the district. First, we'll hear from DC Health's Dr. Baham, and then we'll hear from Wanda Wilson from DBH. So with that, I will turn it over to those guys.
Thank you so much, Melissa. And I do want to say in second that I appreciate hearing everyone's, not only their professional reasons why, but their social context. And I think that's very nice to start off a meeting in that way. I also forgot to tell you what my personal reason was. I'm a mother of 3 that are 6 and under, so very much in the thick of things with them. So I'm here today. Sorry, let me back up. Again, my name is Jasmine Bim, and I'm the Perinatal and Infant Health Division Chief within the Community Health Administration at DC Health. I'm going to present today on perinatal health programs related to perinatal mental health. You can go to the next slide. And I apologize, I'm a bit under the weather here. I'm going to just run through the perinatal and infant health framework that we use to approach our programming and efforts. I'll talk a little bit about the Pregnancy Risk Assessment Monitoring System, PRAMS for short, and talk about selected DC Health perinatal and maternal health programs, and then touch on some future efforts and areas of opportunity. Next slide, thank you. So you may have seen this bubble, as we like to affectionately call it, before, but if not, I'm just going to take a moment to walk through how we approach perinatal health in the district. So the district's framework to improve maternal and child health outcomes is really based on the overarching goal to ensure every community understands its health risks and role in improving perinatal and maternal and child health outcomes. The health status of mothers, as we all know, infants and children, is an important measure of health status of the district's residents, including future generations of residents. And so the driving principles of our approach include the following: using a life course perspective, recognizing that a person's health is determined by factors present prior to conception, addressing the social determinants of health, recognizing that poverty and racism profoundly affect psychosocial well-being and are major contributors to disparities in birth outcomes and lifelong health, implementing systems-level interventions, recognizing that addressing underlying social policies have broad impacts on improving health, building collective impact, and recognizing that sectors beyond public health and medicine must have a role in realizing long-lasting, equitable outcomes for all of our families. And so with those principles in mind, DC Health, a couple of years ago, has developed and is implementing a focused strategy to improve perinatal health outcomes. And that strategy is really built on a framework of these 7 core elements you see here in the diagram. One is that every teenage girl and woman in DC is in control of her reproductive health, that every pregnant woman receives patient-centered, high-quality prenatal care beginning in the first trimester, that every newborn receives high-quality neonatal care in the hospital and outpatient setting, that every parent has the life skills and resources needed to nurture and provide for their family, that every healthcare provider has the tools and resources they need to provide quality care and manage complex social needs of women and infants. And the last 2, that every infant, mom, and dad has a safe and healthy environment to thrive and receive the support they need to promote early childhood development and learning, and that every healthcare facility and organization that provides maternal and infant care has the tools and resources they need to practice evidence-based healthcare, care coordination, and supporting services or supportive services, and document QI and QA activities. Next slide, please. In terms of data related to perinatal mental health, the DC Pregnancy Risk Assessment Monitoring System, or PRAMS for short, is a surveillance system that collects information on maternal attitudes and experiences before, during, and shortly after pregnancy. It really does help to shed some light on maternal, infant, and child health in the district. As you can see here, approximately 89% of mothers reported having a postpartum checkup, which is relatively decent, and 12.8% of mothers experienced postpartum depression. Just wanted to sort of ground us a little bit in some of the stats for our jurisdiction. And so, next slide, please. Now that I've shared a little bit about our overarching framework and some of the data, I'll talk a little bit about some of our programs. I want to note that we do not fund specific programs focused on perinatal mental health at this time, but rather fund several programs aimed at perinatal and women's health that carry out some activities that touch on mental health. And so first, going to talk about Healthy Start. So it's funded by the Health Resources and Services Administration, Maternal and Child Health Bureau, Division of Healthy Start Perinatal Services. And the purpose of this program is really to improve health outcomes before, during, and after pregnancy, in hopes of reducing racial and ethnic disparities in rates of infant deaths and adverse perinatal outcomes. Healthy Start offers a gamut of services and support for mothers, children, and their families before, during, and after pregnancy by addressing their health and social service needs. DC Health is currently in the award period from 2019 to 2024. DC Health provides overall grant oversight and technical assistance and capacity building to our subgrantees, which are Mary Center and Community of Hope. I know there's some representatives here. Hello. To implement the full range of Healthy Start services for women and their families in the district. Next slide. So you can see some of the main services provided by the Healthy Start program include those noted here. We have, care coordination, group prenatal care, doula services and support, reproductive life planning, health education and promotion, breastfeeding support, free transportation, and fatherhood support services, and comprehensive health and wellness screenings and referrals for maternal depression, domestic violence, substance use, and developmental delays are one of the main services provided to Healthy Start participants. Next slide. So next, another initiative that we have is the Preterm Birth Reduction Initiative, which is a $1.6 million locally funded initiative aimed at ensuring healthy pregnancies with a focus on reducing preterm birth, as the title suggests. The 4 preterm birth grantees in the district include MedStar Washington Hospital Center, Howard University Hospital, Community of Hope, and Unity Healthcare. The grantees are really charged with carrying out mental health screening and referral, among other activities, to encourage healthy pregnancies and reduce preterm birth. And you can see some of the other activities here in addition to the mental health screening and referral, like contraception referral and education, and screening for social determinants of health needs. Next slide. Next, we have Help Me Grow DC. Help Me Grow DC is a unique and comprehensive integrated district-wide system that's designed to address the need for perinatal support, provide early identification of developmental and/or behavioral concerns, and then link mothers, children, and their families to various community-based developmental and behavioral health services and supports. The Department of Behavioral Health DC MAP program provides access to referrals and resources to facilitate provider education and training that enhances integration of mental health into pediatric primary care. The program in part focuses on perinatal and postpartum mood and anxiety disorder and early childhood mental health. DC Health Help Me Grow program collaborates with that Department of Behavioral Health DCMAP program to provide brief intervention and counseling supports to pregnant or new parents based on submitted referrals. And so I'll let our partners there discuss that in more depth. Next slide, please. Next, we have the home visiting programs. The Maternal, Infant, and Early Childhood Home Visiting Program, MCV for short, as well as locally funded home visiting programs, are dedicated to really ensuring that residents have access to quality evidence-based home visiting services and provide support to families residing in high-risk communities. Services and support for pregnant mothers, infants, children, and their families begins in pregnancy and goes throughout the early childhood years from 0 to 5 years old by addressing various needs that may come up. Home visitors utilize the Patient Health Questionnaire 9 to measure depressive feelings and behaviors during the past several weeks to determine a person's depression quotient. Then for programs that provide wraparound services, referrals and appropriate treatments take place either internally or to the Department of Behavioral Health Access Helpline if a participant has consented to that referral. Next slide, please. Next, we have Healthy Steps. Healthy Steps is an evidence-based interdisciplinary pediatric primary care program that aims to provide infants and toddlers with social, emotional, and developmental support by strengthening family engagement with a medical home. As part of the program, the Healthy Steps specialist, who's the child development expert, joins the pediatric primary care team to ensure universal screening. This could be for mental health, this could be for social determinants of health, and provide successful interventions and referrals and follow-up for the whole family. Healthy Steps specialists use also the Patient Health Questionnaire 9 to measure depressive feelings and behaviors during the past week to determine a person's depression quotient. And similar to the home visiting program, referrals and treatments take place internally or to the Department of Behavioral Health Access Helpline if a participant has consented to referral. Next slide, please. And so just, I mean, you know, we're here to collaborate on this, but just a couple of notes here on future efforts or areas of opportunity. A potential space is to integrate mental or perinatal mental health activities into the Title V Maternal and Child Health Services Block Grant Program activities. So currently we fund several projects with that program and funding, and they focus primarily on child and adolescent mental health. So for example, we fund the WENT Center for grief and trauma-informed care for children and adolescents. But we do have several Well Woman projects and projects focused on prenatal care at Unity Health Care and La Clínica del Pueblo that we could perhaps look to expand, you know, the perinatal mental health activities that are maybe not going on right now. So that's one. Secondly, we're currently drafting hospital discharge regulations in alignment with the Babies Bill. And some elements that we're drafting in those regulations include ensuring mental health screening and referral, you know, during and upon discharge, and the provision of resources for assistance for mental health. And so those are two really good areas of opportunity to help with this issue. And then lastly, just, you know, collaborating through this task force with everybody to discuss some of these existing programs and areas where we can intervene and expand to a more systems level approach. And so next slide. That's all I have for you today. If you have any further questions, you can reach me at perinatal.health@dc.gov. Thank you so much for your time.
Thank you so much. I know you're not feeling 100% today, so thank you very much for pulling it together to join us despite feeling a bit under the weather. So thank you so much. With that, I'll turn it over to Wanda Wilson to give us kind of the lay of the land from the DBH perspective, and then we will move quickly to wrap up our task force business and close the meeting this afternoon.
Okay, thank you very much. First of all, I apologize for not having my PowerPoint. Had some technical difficulties earlier, and it just completely disrupted my slides. But nevertheless, I'll be happy to email anyone who's interested in the slides. Please just indicate it in the chat, and I'll be happy to see to it that you get copies of the slide. So again, I'm Wanda Wilson. I'm a clinical social worker with DC Department of Behavioral Health's PEACE program, Parent and Infant Early Childhood Enhancement Program. We're located at 821 Howard Road Southeast. The PEACE program is divided into two main components. One being early childhood intervention and treatment services, and the other being our infant and maternal health component. Over at the PEACE program, we provide services for children 7 years of age and younger, and their families. Our mission is to provide culturally competent, community-based mental health services to the infants and young children and their families. The goal, as always, is to intervene early, as we know that early intervention is the key, and that is our goal, to always provide these services at an early age. And over the years, as we've been providing services to young children and their families, we realized that one common denominator that a lot of the families were presenting with was mental health issues, mental health challenges, especially with the moms. And some years ago, we actually worked collaboratively with DC Department of Health as a part of their Healthy Start project program, where we provided the mental health services for the women in wards 5, 6, 7, and 8 who were of childbearing age and presenting with mental health challenges. So as of today, we at the Behavior of Mental Health have continued on with that program, focusing still on women in wards 5, 6, 7, and 8, and young children ages birth to 2 years. The mission of this program continues to be to focus on the reduction of infant mortality, and that's through improving the emotional and mental and physical health of pre and postnatal women in the district. Through our program, we offer a variety of services, including individual and group counseling, family therapy. We even we do a lot of referrals to other agencies, primarily trying to developing kind of a one-stop shop. So the women come in and an intake is done where we do a diagnostic assessment. And to begin the services, we too use I heard somebody mention the PHQ-9. We use that too as a screening tool for the women who are in for services. We use kind of a psycho-ed base, but including and incorporating the other mental health challenges that the women are presenting with. We work we work in collaboration with our psychiatrists. We have 3 child psychiatrists on board, and as needed, they provide evaluations for medications as needed on the women that are seen. We have been certified in a number of the evidence-based practices, one being the ABC, which is an evidence-based practice that focuses on the strengths of moms, young moms. It's a practice that we find to be very, very helpful in that it's a very brief, it's a 10 weeks practice where there are 10 sessions that are provided, and it's in the moment sessions with the women where we do a lot of videotaping and have direct feedback with moms regarding parenting strategies. Again, focusing primarily on their strengths. We provide a lot of coaching through this evidence-based practice, and we've had really, really good results with the women that we have seen.
Wanda, if you don't, pardon me for interrupting, we are just about at time. If you can wrap up the next minute, that would be great. And if we need to make sure we have some time set aside to finish your presentation at our next meeting, we can do that as well.
Okay. So why don't I just say, so if you know of anyone who's interested, or if you'd like to hear more about our program, feel free to give me a call on 202-698-2386, and I'll be happy to go through all of the programs that we have here for maternal mental health.
Thank you so much, Wanda, and sorry to rush us at the end here. We have a couple orders of business. I want to walk back to the nominations for co-chairs. Amy and Nandi have come up with what I think is potentially the perfect solution, and would like to recommend, if the task force is amenable, that both Nandi and Amy serve as co-chairs along with myself. That way we really bring in both a community and a clinical perspective through our leadership group, and can make sure that that's how we're leading the group going forward. So are there any comments, questions, or concerns with that approach today? I like the love. We're getting love for that one. Okay. Fantastic. Well, thank you, Nandi and Amy. I look forward to working with you guys even more closely than the rest of the task force. I think we have to, Deshawn, do we have to vote or are we just appointing? Okay, welcome and congratulations, Nandi and Amy, being co-chairs of the Perinatal Mental Health Task Force. Lots of great response and love for you guys for stepping up. So greatly appreciate it and look forward to working with you. Our next order of business is setting our meeting cadence. Based on the availability for today's meeting, we do recommend our standing meetings occur at 4 p.m. on the last Tuesday of the month. Is there any discussion on the meeting schedule? Does that generally work for folks? Good time, good day, neither good time, neither good day? So what I will do is
Lots of thumbs up, so we're good to go.
okay. I'll do the formal. Is there anyone that would be willing to put a motion forward to set our meeting cadence as the last Tuesday of every month at 4 p.m.?
I move that we do our meetings the last Tuesday of the month at 4 o'clock Eastern Standard Time.
Much. Is there a second?
I second. This is Amina Hamilton.
Okay, thanks, Amina. All those in favor? Do a voice aye or a thumb aye.
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 All those opposed?
Aye. In favor.
Got it. Okay, we'll see each other back here at the last Tuesday of February. The last, I think, order of business is one person that we are, or one chair that we're missing on the task force is a doula representative. If you know of anyone or you or yourself as a doula and you would be interested in participating as a task force member, please reach out to Deshawn Groves. His email is before you by close of business this Friday, February 3rd, if you can believe we are already in February. So I will pause for a moment to open up to public comments. Don't think I've seen any questions through the chat, but if anyone from the public, so anyone who is not a member of the task force, would like to comment, raise any questions, etc., this is your time. One more moment.
Hi, good evening, everyone. I apologize to belabor the point. This is Deja Love. I'm the CEO of a community-based enterprise, small business enterprise here in the district, the Black Women's Wellness Agency. Just a quick question. Given the focus of this task force, I just would invite us to really center the role of how medical racism shows up, given that Black birthing persons are substantially, there's huge public health disparities in terms of outcomes and access. I really hope that that will be a key focus, given that I think 2 weeks ago, Community of Hope had a documentary screening, Birthing Justice, that really talked about this. So I didn't hear that explicitly, but I would welcome just really holding space for that.
Thank you so much, Deja. It's good to see you as well. And I do think, although we may not have explicitly said it, when you look at the legislation there, that it is specifically called out in terms of making sure that's addressed and considered throughout our work. So thank you so much for that. Any other public comments? Okay, and with that, thank you everyone for your participation today. You will be hearing from Deshawn Groves on next steps and what to expect. And with that, I will adjourn the meeting at 5:05 p.m. Thank you, everyone. Have a great evening.
Thank you.
Thank you.